am Dr. Mohd Aslam, intervention nephrologist working at Jawaharlal Nehru Medical College, AMU, Aligarh. At present, I am associate professor in the Department of Medicine and in charge of nephrology division at AMU. So today, you all know that this week we are celebrating as a kidney week, healthy kidneys for all. And you know that every second Thursday of every year of March month is Kidney Day, World Kidney Day. And the themes are different every year. So focus is awareness about the kidney diseases, especially in our country and the population of Southeast Asian region. You all know that previously we have a number of other diseases which are causing chronic kidney disease. But in the recent past 1 decade, almost 10 to 15 years, the rise in the incidence of diabetes has taken along the foremost runner of chronic kidney disease. And especially the burden of diabetes is increasing in the Southeast Asian population. So because of the rise in type 2 diabetes, the number of kidney diseases are also rising. Previously, we have hypertension as the cause of kidney disease, but now diabetes has taken as the leading cause of kidney disease. Now, we all know that type 2 diabetes isn't just an iceberg, what we are seeing. And most of the patients are undiagnosed for a long period of time, and they present with some form of target organ damage, and kidneys is one. So basically, the diagnosis of type 2 diabetes is very important at an early stage, so that the prevention of kidney disease has to be started at early stage. Now, so what is very important that any patient visiting to any physician, surgeon, or orthopedician, or any of the private practitioners, the most important thing is that these patients should get a blood sugar and a blood pressure recorded, because the patient is not going to visit you frequently. And most of these patients of hypertension and diabetes are diagnosed once they come for some other reason. So this is very important, and we have to just break the iceberg and bring these people to the forefront, so that the blood pressure and sugar is controlled and the incidence of kidney disease is decreased. Now, in Southeast Asian region, as the incidence of diabetes increasing, the burden of kidney disease is also increasing. Some other factors are also important, like the people of Southeast Asia are genetically prone for kidney diseases. The other very important reason is that in our country, or you can say in the Southeast Asian region, people usually take over-the-counter drugs. And these analgesics and some alternative medications are there, which are very harmful to the kidney. So people are advised, or they should be aware, that any drug should not be taken without a proper prescription from any doctor. Third very important thing is other lifestyle diseases like obesity, like hypertension, will also lead to chronic kidney disease if it is not prevented. So a healthy lifestyle is very important. Taking a good amount of water is very important. And secondly, cutting down on the salt, because the hypertension of Indian and the South Asian people are salt sensitive. So if we cut down the salt, our hypertension will come down, and this will obviously bring the chronic kidney disease cases at a lower level. And the fourth most important thing is the change in the lifestyle, that taking stuffed food or fried foods or taking junk food, we have to avoid, and taking a good amount of at least 45 minutes a day. A brisk walk is also very important for controlling the weight of the patient, and this obviously will have an impact on the form of chronic kidney disease. So a general awareness about all these things is a part of World Kidney Day theme, healthy kidneys for all. And this is very important because the preventive measures are more important as treatment. Now the treatment is limited. We have dialysis if the chronic kidney disease is there, and then transplantation, and the resources are very limited in our country. So basically we have to prevent the disease, so that these other things, modalities, doesn't come into play, and because of the financial reasons, patients are also not able to take it. So preventive measures are very important, and this should be done by creating an awareness, and this World Kidney Day is basically creating awareness among the general population. Thank you very much for your patient hearing.